we talk about, this is a different way to do healthcare, but for thousands of years, this is how healthcare was done.
Yeah.
And so really insurance is sort of the new thing. I mean, it's only been, the last 60 or so years that, group insurance and the insurance market has come along. For, thousands of years, this is how folks cared for each other, was by bearing each other's burdens, and the family come together, or the church at large, to help with healthcare costs.
Absolutely, brother. I love that you said that they're, bearing each other's burdens, and in so doing, fulfilling the law of Christ. Paul's words ring true so much with the mission of Samaritan Ministries. And I thank you personally so much for the work that you guys do in helping Christians to bear each other's burdens, because it is a burden. Healthcare it really is a burden, especially in this world that we're living in, where people seem to be more heightened to the dangers of COVID and other different things like that. It certainly does feel very burdensome, and Samaritan has lightened that burden for so many people.
Yeah. Yeah.
Absolutely.
And one of the things I appreciate, I mean, people look at cost a lot. Through my 20 years of using this for my family with 4 kids, I appreciate more than the costs, the freedom, knowing where my dollars are going, but also the freedom to make choices for my family that works the best. I think I told this story to Dan one time. My son cut his arm kind of late at night. We're on the way to the emergency room, and I had a choice. I could go down our main street. I could go left to one ER or right to the other. I knew that one of them had a pediatric ER and it was a little bit more suited towards a kid, at 11 o'clock at night. And I was able to make my choice because those healthcare dollars were in my control. And I hear that from members. They love being able to make a choice.
Amen. That's so good. Joel, share with us just a little bit about how Samaritan has been doing in facing some of the different challenges and threats that have been coming at it. What are some of these challenges coming at Samaritan Ministries, and how have you guys been able to respond?
Absolutely. I think one of the biggest challenges is just being confused for insurance. We try, we go over the top in our material, everything that we put out there, our guidelines, to explain that we're not insurance. But sometimes there are bad actors that confuse that, and it rightly gets regulators a little ramped up. So just working in the regulatory world, and that's a lot of what I do, is just reassuring the regulators, reassuring the legislators that we're not insurance, and that we need to stay outside of the insurance, code in the states, and just making sure that, we're doing everything we can to not cause any consumer confusion, and just to stay out of that, type of confusion. And we work well with a lot of the other ministries. We have great partnerships with a lot of what, in the world would be called competitors, but we work well together. And just to be able to help, keep our members free. That's ultimately what we want, is our members just to be free and unburdened from, any kind of governmental, shackles.
Excellent, man. Excellent. Really good stuff. Joel, we may have some listeners like myself at one point. It was not that long ago that I would have been on the fence about joining Samaritan Ministries, because like you just said, I was, I was maybe thinking, okay, it's not traditional insurance, so is it going to be able to cover me? I'm sure there's a lot of people out there like that as well, who might be looking at it, considering it. They're Christians, they want to be faithful with their money, but it's just something that they don't know. What advice might you give to someone who's on the fence about joining Samaritan Ministries?
I would say for the Christians that God is faithful. And I understand that. 20 years ago, I was coming off, a Cadillac insurance on my parents' plan. Both my father and my father-in-law were at a Fortune 500 company, and I could see, the worry in them was like, oh man, we're going to end up having to help, this young couple with all these healthcare costs. And, it was a leap of faith from insurance, but not a big leap. We knew that God was faithful. We knew that God controls it all, and that we could take this step out, and God would care for us. And it's not to say, this is just blind faith and, oh geez, I hope it works out. Samaritan, we've been operating for 27 years, billions of dollars in that 27 years, roughly 35 million every month is going member to member.
Wow.
So it's not just blind faith. I mean, there is that backing it up. over that 27 years. And I share this with regulators. In that 27 years, to our knowledge, we've never had any member complain to a government agency, to any consumer advocacy agency over that time. Not to say that, members, don't call in and they have, some things that they'd like to see differently. But in terms of having to take it to like a government regulator or anything like that, to our knowledge, we've never had anyone, be that upset or, have that big of a problem. I mean, we do very well in, dealing with members and, taking care of, and our members or our membership development do a great job on the front end explaining this. And so the members coming in are usually always well aware of, this is not insurance and how it works. And so I give, tons of kudos to my colleagues that are taking those phone calls. They do a great job, introducing us on the front end.